Yeah. Okay, so I'm Rafael and I'm gonna be teaching you how to do a patient assessment. So the first thing we want to do is we want to put on our BSI, which is our isolation precautions. We want to determine once we get to our scene, we want to determine that it's safe. We want to determine our mechanism of action, so we're on call to a medical problem. Once we get to our scene, we have to assess our situation, and if necessary, we want to request additional EMS for the patient. If we think there's any trauma to the spine, we want to make sure we stabilize the spine. In his case, it doesn't look like he had any trauma, so he's good. So for primary survey, we want to determine responsiveness. This can be done just by talking to the patient. So, hi sir, what can we help you with?
I'm having some chest pain.
You're having some chest pain. The patient is responsive. He's just responding to our questions. So what's your main problem? The chief problem? Some chest pain. Okay. We want to assess the airway and breathing. We want to make sure that there's enough breathing going on, that the patient is having adequate ventilation, and there's appropriate oxygen. If you see that the patient is in any sort of respiratory distress, we want to give them oxygen. Also for circulation, we want to assess the skin. We want to make sure that they're having enough perfusion to their fingers. So we want to assess for any major bleeding. It doesn't seem like it. Want to assess the skin. So the skin is nice and warm. It's actually pale, moist, and cool. We want to check for pulse. So we want to check for 15 seconds and then multiply that by 4.
15, 30 seconds, 45, right? And just count here.
So it's 20 times 4, that'll be 80. Also, we want to make sure that we have identified our priorities. Since he's having some chest pain, we're more worried about circulation, some sort of cardiac problems. So now we want to move on to our history taking. We want to ask the patient about the onset. So when did your pain start?
About 20 minutes ago.
About 20 minutes ago? What were you doing when your pain started?
I was just out in my backyard cleaning my car.
You were cleaning, so you were doing some yard work? Can you describe your pain?
Like a lot of pressure, like I feel like something's pushing on my chest.
In your chest? How bad is your pain? On a scale of 0 to 10?
About a 10.
About a 10?
Yeah.
Okay, what provokes your pain or what starts your pain?
Just doing anything, I just feel like there's a lot more pain.
And does your pain move around?
I felt it radiating in my arm, just a little bit on my neck.
On your neck? Okay. And for how long has your pain been going?
Just about 20 minutes.
Oh, you said 20 minutes? Okay. After you do OPQRST, you want to move on to your past medical history. Are you allergic to any medications or foods? No? Do you have any history, any pertinent history to any medical problems?
I just had heart surgery.
You did have some heart surgery? How long ago?
Like about 10 years ago.
10 years ago? Okay, you want to also ask them about the events leading to this history. So what were you doing before this started? And you didn't have any pain before that?
No.
No? Okay. Are you taking any medications?
Yes, medication.
For your blood pressure? Okay, and when was your last oral intake? When did you have something by mouth?
About 2 hours ago.
2 hours ago? Okay. Now we wanna, after we ask our questions, we have a main idea of what our priority is. Since he's having some sort of cardiovascular problems, we want to make sure we take vital signs such as blood pressure, pulse, and we want to assess their respirations. So we want to take their blood pressure. Relax your arm. So the blood pressure was 100/64. We have already assessed the pulse, which was 80. Now we wanna check respirations. So I want you to take a deep breath. Want to move my stethoscope? Okay, lungs are clear and or equal on both sides. We also want to ask the patient for more signs and symptoms. Are you having any nausea? Have you vomited? Any? No?
I just don't feel like
Okay, that's good. We want to check for capillary refill just to make sure that he's getting adequate circulation. Okay, it's less than 2. After we take our patient to the ambulance and on our way to the hospital, we want to reassess the patient. We want to do every single thing we did. We want to do ABCs, and then we want to ask about the pain, OPQRST, and then we also want to say that there's more EMS on our way. Thank you very much.